Good morning, everyone. For those of you who don't know me, my name is Vincent Garrett. I'm one of the co-founders of the C.H.A.N.T Training Academy. As you can see, I'm up here with my mask on. The reason that I wear my mask is because I care about the people that are around me here in this room. And I also wear my mask when I'm out in the community because I care for those that I may not know. We are safely 6 feet apart in here, having a socially distant webinar. So I think it's safe to remove my mask just so that you guys are able to clearly hear what I want to communicate to you today. So C.H.A.N.T Training is an organization that was built by clinicians in this area. We're here in Riverside, California today. Our team is made up exclusively of licensed clinicians, physicians, physician assistants, registered nurses, licensed therapists, and a bunch of people that really just care about the common good. So today, we're going to give you a little bit of background on our organization and our program. And our goal is that hopefully after an hour of you hearing some information about our program and some personal stories from our registered nurses, you will want to be a part of the solution of decreasing the spread of infectious diseases, not only COVID-19. So what we're going to go over today is C.H.A.N.T Training, the 5 key, an acronym that helps you remember the 5 key actions that will help prevent the spread of infectious diseases and ultimately keep you safe while you're at work and while you're out in the community. We focus first on the C. The C is for cover your face. Wearing a face covering is a universal sign of respect that you've taken the time and you care about others and you want them to be safe. You don't want to give your germs to others. Wearing a face covering needs to be worn correctly over your mouth and over your nose. And you want to feel confident talking with the person that's across from you to ensure that they have their mask on as well. 2 people wearing a mask gives you 95% chance of not spreading a virus between 2 people. Your mask keeps your germs in, the other person's mask keeps their germs in. The next that we talk about is the H, for hand hygiene. Washing your hands for a minimum of 20 seconds. Washing your hands for a minimum of 20 seconds greatly reduces the spread of infectious diseases from your hands to your mucous membranes, your eyes, your nose, your mouth. Washing your hands for a minimum of 20 seconds in hot water kills germs 99% of the time. Next, we look at the A, which is always disinfect. Germs are everywhere. They're on our phone, they're on our keys, they're on door handles, they're on commonly used surfaces. Disinfecting these commonly used surfaces in between multiple people touching the same surface greatly reduces the spread of infectious diseases. All of the information that's been made available by the CDC, by the Department of Public Health, by all of these governing bodies, right, by your primary physician, sometimes can be difficult to retain all. I myself have a background as a healthcare administrator, but I do not have a clinical background. I am not a registered nurse. And when COVID-19 was first present in our facility, I myself had questions. So I know that others have questions as well. But what I did is I wanted to seek out as much research as I could. I wanted to partner with clinicians that work around infectious diseases every day of their careers. And one of the key takeaways that I learned is even though they work around infectious diseases, we have a nurse here today that works in a COVID testing site. We have a nurse here today that works in a COVID inpatient hospital floor. Neither one of them have tested positive for COVID-19. And why is that so many people that don't work in these environments are testing positive? It became clear to us that we needed to launch a national education campaign that could help give individuals the skills that they need to live in a pandemic, as well as keep themselves, keep their family members, keep their staff, and keep members of their community safe. Covering your face, washing your hands, disinfecting common areas, as well as keeping a safe distance 6 feet apart from others. It's a trivial term, 6 feet apart. When you understand how germs are spread, right, through particles that you can sneeze or cough out, through germs that get on your hands from touching surfaces, from not wiping down surfaces, and from being in large groups, close together with others. One person can spread an infectious disease to 400 people in 30 days if they don't practice social distancing. 400 people that are carriers for a virus, whether they're symptomatic or asymptomatic, can infect 400 million people. So when you hear of the world battling with a pandemic, this is why. It's because people haven't brought into the information that's available from the CDC. So we're hoping that if we repackage it and just get more members of our community to remember the 5 key actions of C.H.A.N.T. Cover your face, hand hygiene, always disinfect, not too close, and temperature checks. Checking your temperature is the best way to identify if you are struggling with an infection. Very important. A temperature or fever does not indicate that you have COVID-19. But what most nurses know, what most physicians know, when you feel ill, when you feel hot, putting a cold towel is not enough. You need to check your temperature. Most people that we've learned through our training, number one, have questions about the effectiveness of having your temperature checked with a contactless device. There's a lot of information out there that makes people believe that doing that may cause brain damage. There is no science to support that idea. Checking your temperature is essential to identifying if your body is battling some sort of virus, some sort of infection. And when you know your temperature, that's going to give you the confidence to know that you should stay home from work. You should probably isolate from others. You should seek out medical treatment to know what is going on. Who is the C.H.A.N.T Training Academy? This is our story. C.H.A.N.T Training is one of many training programs provided by GSM, or by C.H.A.N.T Training Academy, which is a subdivision of GSM Management and Consulting. We have backgrounds in real estate consulting. We have background in HR consulting for medium and large-sized organizations. But for C.H.A.N.T Training, we did not want to add this service alone. So we've brought in the very best nurses, the very best physicians, and we want to talk with you and provide clear education for your business, for your staff, for your school, that will keep your students and keep your community safe. Our mission is to educate and prepare organizations on how to prevent the spread of infectious diseases and enable business continuity. The governor does not want to shut down businesses. Business taxes pay elected officials and government officials' salaries. They do not want to close businesses down. But if businesses or individuals can't understand their role in limiting the spread of infectious diseases, the government has a duty to protect its residents, which leads to shutdown. Through C.H.A.N.T Training, we give individuals and businesses the tools they need in order to protect themselves, which ensures business continuity. So today we're going to go over a brief history of infectious diseases. We're going to give you information on COVID-19, the differences and the terms that are available or out there. We're going to go over what are the government regulations for individuals and for businesses, what is our certification, when is our training available, why you should get our certification, how do you get C.H.A.N.T certified. We're going to cover all of that today for you. A brief history of infectious diseases. I'm a person who likes to do puzzles, and I'm a person that's aware of patterns. And I hope that when I take you through this timeline, everyone on the call or everyone in the room can begin to develop and understand what are the patterns with infectious diseases. So what do you know about infectious diseases? 17 million people die every year from various infectious diseases. not just COVID-19. HIV, E. coli, influenza, all of these viruses that are out there that are contagious. 17 million people died every single year before COVID-19. They're caused by microorganisms such as viruses, bacteria, parasites, and fungi. What is a novel virus, right? That's a term that people hear. What is a novel coronavirus? A novel virus means it's a new virus. It's a virus that has not been previously identified. So even if you have the best physicians in the world, even if you have the best clinical scientists in the world trying to develop treatment options, how can they when the cases continue to rise? How can you, if you're in manufacturing and you're building a prototype, this is going to be your first SKU number, your first item you're going to offer to the public. And you're asked that while you're still learning about this product, you need to provide 30 million units, right? We're talking about a virus that's spreading to hundreds of thousands, millions of people every single day, continuing to spread while you're still trying to figure out what are all the effects of this virus. That is very difficult, even for the smartest minds in our world. It's all of our responsibility to help reduce total cases so that the physicians, so that the scientists, so the laboratories can develop long-lasting treatment options. Right now, our physicians are trying to build an airplane while it's in the air. If we can work together and reduce the spread, that's going to allow our physicians, all of our medical professionals, the time and the resources they need to develop effective treatment options. A coronavirus, right? You hear novel virus, you hear COVID, you hear coronavirus. There are 7 coronaviruses currently that affect humans. Typically, a coronavirus affects your respiratory system. So when you hear about different treatment options that are out there, hey, if I get put on a ventilator, chances are I'll be okay. Keep in mind all of the treatment options that are currently available treat the symptoms. They do not treat the virus. And especially when you take into account there's a number of asymptomatic carriers in our community where there's a shortage of testing, there's a shortage of medical supply. It means that the responsibility is not only on the medical community. The responsibility is on each one of us to do our part to limit the spread of this virus. So a coronavirus is going to affect your respiratory symptoms. Viruses can spread in many ways: through the air by coughing and sneezing, through close personal contact, and through touching contaminated surfaces. If you remember C.H.A.N.T, which is cover your face, hand hygiene, always disinfect, not too close to others, and temperature checks, you're going to prevent the 3 key ways that viruses are spread. A history: Spanish flu, 1918, 500 million cases. Somewhere between 17 and 100 million deaths. In 1918, we didn't have the reporting structure that we have now, so it's hard to determine how many deaths. But there's no reason to think COVID-19 could not have 100 million deaths if people don't change. 1957, the Asian flu, 4 million deaths. 9 years later, the Hong Kong flu, another 4 million deaths. This is what I say when I talk about patterns. 9 years apart, 2 viruses, 2 epidemics hit China. If you understand the timeline, you're going to understand there will be another virus after COVID-19. But the effects of the virus can be greatly reduced if all of us take it serious from the beginning. 2 viruses hit China 9 years apart. In the 90s, in the 2000s, I was noticing when I get on an airplane or when I'm traveling, sometimes people that were born in Asian countries, they've already been wearing masks. And before I understood, that was a cause for me to question why. But when you understand, they've seen 8 million people, wives, parents, children die from a virus, and they've seen the economic impact that follows an epidemic. It took United States, people here in America, took us 20 years to understand that HIV was not a homosexual virus. How long will it take us to understand that wearing a mask is not a political statement? It is an issue of public safety. 2003, we have the SARS virus. 9 years later, 2012, we have MERS, our second coronavirus, right? Second of 7 that we know affect humans. Another 7 years later, we have COVID-19. So when you see patterns, you see 9 years between SARS and MERS, and then you see 9 years between MERS and COVID-19. What does that mean? COVID-19 will not be the last virus. But if we can change right now, we will ensure that the effects will not be as great. So I'm going to talk a little bit about COVID-19 specifically, but we're going to start here with a story. I'm going to invite one of our RNs up. Her name is Gwen, and she personally has a very personal story on how COVID-19 affected her and her coworkers.
Hello everyone, my name is Gwen Garrett and I'm a registered nurse. I have 8 years of hospital experience, and before I became an RN, I received a bachelor's degree in public health with an emphasis in disease prevention and promotion. Throughout my career, I have never seen an infectious disease like COVID-19. I personally have never seen and felt fear from healthcare experts like I saw from our physicians and my fellow coworkers. Today, I want to share a personal story with you how COVID-19 affected me, my coworkers, and several first responders here in the Inland Empire. On April 5th, I received an urgent message from my hospital that there was a community emergency and that all nurses needed to report to work if they were available. Immediately, fear crept in, and I was freaking out. I thought to myself, is there a COVID-19 outbreak at my hospital? I started texting my coworkers that were scheduled to work that day, and I asked them what they were seeing and what the work environment was like. They told me that several nurses from the hospital were going to be deployed to a local nursing home to care for patients that had tested positive. They were asking our nurses to go out and help the nursing home that was drowning with COVID-19 patients. They needed our help. This was deemed a code triage because the nursing home had no nurses to take care of the patients. This nursing home had 80 patients, and the reason why they had no nurses to take care of them is because some nurses also ended up testing positive for COVID-19, and the other nurses, they were in fear of catching it themselves. Therefore, they chose to stay home. I couldn't believe this was happening, and I remember watching the news to clarify if this story was true, and it was. I watched the news report right before my eyes, and at that moment, I realized that this would be a defining moment in my career. When I returned to work the following day, I was shocked to hear that my floor was now declared as the COVID floor and that the patients from that nursing home would be sent there. In addition to this, I was 3 months pregnant and I had a toddler at home. My mind was racing. I became so overwhelmed with emotions. I was angry, I was scared, I had no control of the situation. At this point, I was no longer fearful for my own well-being. All I could worry about was the health and safety of my children. I have a public health degree and I'm a registered nurse, but I'm also a wife and a mother. And when COVID patients come to our floors, we are all at risk. There is no treatment for our patients, and there is no treatment for nurses who become patients. Based on my training and experience, I know there are 2 ways we can eradicate this virus together. One, we hope and pray that someday a vaccine will be developed and to fight the disease. And two, we educate ourselves and others how we can protect ourselves and prevent the spread of all viruses. C.H.A.N.T training provides the foundation for a sound education for everyday people with infectious disease prevention. Thank you.
I think that touches on something that's very, very prevalent in our community, right? You hear it all the time. Nurses signed up for this. Doctors signed up for this. That is not the case. Nurses signed up to care for people. Doctors signed up to diagnose and care for people. But when you understand that the cases are bubbling over in our skilled nursing facilities, they're bubbling over in our hospitals, it's time for each one of us to now play a role in decreasing the spread of this deadly virus. So COVID-19 was first identified in Wuhan, China in 2019. The thought is that it was a mutation took place where the virus was able to change from going from an animal host, now going to a human host. COVID-19 is caused by a coronavirus called SARS-CoV-2, right? We understand there are different strains of viruses. We understand that viruses change, they mutate, and that's why it's very clear to us that even if a vaccine is developed, there is no guarantee that that vaccine will treat every single strain of the virus. And once again, how will we deal with those that don't believe in vaccination? So to think that we're on the cusp of getting back to Disneyland or we're on the cusp of getting the schools to reopen is not a good position to take unless you are one of the people that are practicing C.H.A.N.T. You should probably stay home. There's currently no FDA-approved treatment for the virus. All of the treatment options currently are a guess at best. The physicians, they need more time, and we have to help create the time for them. There's currently no vaccine, and there's currently no cure. So when you understand no treatment, no vaccine, no cure, your mask is your only protection. Your mask is the only way that you protect others, right? Impacts on huge organizations out there. If you work for a large organization, you are at risk. If you work for a small organization, you are at risk. You are at risk if you have not sought out education and information from those who know the most about viruses. Not your attorney, not your workers' comp insurance company who's putting out guidelines that are going to ensure profitability. This is your time to have access to licensed clinicians in your area that can help provide easy to understand education so that you can protect yourself, protect your family. A Walmart store has had, this was in Colorado, 3 employees died from COVID-19 that they got while they were at work. You don't want to be that employee. The El Pres Beach Bar in Pacific Beach, a small family restaurant, was shut down for several days due to a blatant disrespect to social distancing. If you know what I know, or what any healthcare worker knows, it's difficult to get excited about going to a bar right now. And if you are there, why would you not want to wear a mask? We talk about the story of Which Witch, but the nurse that story's personal to is going to speak in just a little bit, so I'll hold up on that story. So we're going to have Anya come up and talk. She is an experienced registered nurse as well. She currently works in a COVID testing site, and she has a lot of other experience. She's going to come and share her story with the group on how COVID-19 has affected her.
Hi, my name is Anya Easter. I'm a registered nurse with 12 and a half years of experience. I've worked with childhood cancer and blood diseases, and pediatrics, urgent care, and also family medicine. Since the start of the pandemic, my role at work has primarily been to test patients for COVID-19 as well as educate them on the virus. In a single day, I've tested 61 patients myself. The experience has given me insight into how serious the virus is, as well as how well the community is handling it. I educate all my patients on how to self-isolate or self-quarantine at home during the testing process while they're waiting for results. This is so that if they are positive, that they don't spread the virus to someone else during that period. With that being said, there's been more than one occasion that I've tested patients and then I've seen them out in the community during my lunch break. So what Vincent was talking about with Which was one day I went there for lunch, and as I was walking in, the partner of a patient that I had just tested was leaving Which to get into the car where she was waiting. And although he wasn't tested himself, he was in close contact with her. So there was another instance where there was an elderly couple that both were tested, and then during our lunch break, myself and a coworker had seen them at a dine-in restaurant eating, no mask on. So the point that I'm trying to make here is that we don't know who we come in contact with on a daily basis, whether it be the bank, the grocery store, gas station, just in passing. You don't know if that person has COVID-19. Maybe they were tested for COVID-19. Maybe they're positive and they don't think that they can spread it because they don't have symptoms. It's our only line of defense in protecting everyone's health, as well as preventing further economical damage, is to be proactive with these viruses. C.H.A.N.T is that proactive measure. Cover your face, hand hygiene, always disinfect, not too close, and then temperature checks. That's it. Thank you.
Our nurses, our clinicians know the most about this virus, right? I want to highlight this nurse here in the photo. What does she have on? She has on an N95 mask, right? 95% filtration of particles so they don't breathe them in. But that's not enough. She puts a surgical mask on over her N95. And then what does she do over that? She has to put on eye protection, a face shield to protect herself from any splatter, right? Then she puts her hair in a hairnet, right, so that her hair isn't exposed. Puts on a gown, puts on booties. This is what the person that knows the most about COVID-19 has on. And what do you have on when you're out at the bar, when you're at Which, when you're at the gas station? All you have is your mask. And how can you feel comfortable being out without that at the very least? Impacts on travel, right? Carnival Cruise Line had an outbreak on one of its last ships that set sail. 1,500 people tested positive. 1,500 people. The entire cruise ship was stuck at sea for 30 days. No port in America wanted to allow them to dock. How can we get back to being able to take a cruise if we don't decrease the spread of the virus? Right? Some of the things that we all enjoy doing, we are not able to do that until we decrease the spread of the virus. American Airlines just registered its 8th death. 8 flight attendants have died from work-acquired COVID-19. How can you feel comfortable going on a flight knowing that the people around you may have COVID-19, and as soon as the flight attendant walks by, they might take their mask off? 8 flight attendants have died, work-acquired COVID-19. The questions that they have, I'm sure, are the same questions that teachers have, that people that work in warehouses have, is what is our solution to keep ourselves safe? If we're going to reopen and we're not going to work from home, how can we ensure that we're safe? C.H.A.N.T training and the key principles of C.H.A.N.T will give you a 95% chance of remaining safe in your workplace and in the community. Hilton has invested $120,000 in cleaning every single one of their facilities. What has your employer done? Have they mixed water and bleach and sprayed it around the facility? Because EPA-approved cleaning is the only way to ensure that your workplace is safe. Extended care hospital rivers. I'm going to start with New York Presbyterian Hospital. The story of Dr. Lorna Breen. Physicians and nurses have been our most trusted advisors on medical issues from the beginning of time. This physician was the chief of the emergency room at New York Presbyterian Hospital during COVID-19's March peak in America, right? New York City was originally the hotspot. I believe California is working hard to take their place, and we're hoping that through our education we can help decrease the spread. But Dr. Lorna Breen, an emergency room physician, right, studied her whole life to become a physician. Many years of schooling, advanced education, residency, and she elects to go to the emergency room with some of the most skilled physicians, in her hospital. And after she became an emergency room physician, she went a step further to become the chief of the emergency room, a leader of leaders, a leader of people that have the most experience dealing with trauma, infectious diseases, and other crisis management situations, right? This is a person who prepared for this moment. COVID-19 hits in March. Her physician colleagues are getting sick. Her nurses are getting sick. People stopped showing up for work due to quarantine. Patients were dying from the virus, where there was less access to information than we have now. Surrounded by death and uncertainty, Dr. Lorna Breen committed suicide. The person who knew the most committed suicide. So if you're a business owner or a manager or a teacher or a principal and you have questions, saying, I'm just going to wait it out, is not the answer. You need to seek education from the people that know the most. Because when you know more, you can do more. The Life Care Center, that was the first nursing home that registered a positive case, right? COVID-19 enters in Washington State at the Life Care Center. Extended Care Hospital, Riverside. My wife Gwen spoke about that earlier. You must know what that looked like. Imagine a nursing home. Imagine your grandparent, your loved one. Imagine the one person in your family that you know that cannot afford to get sick. Then imagine them in a nursing home with 30 COVID-19 patients. Imagine now that the nurses have also contracted the virus. The people that are there to keep your loved ones safe are now not there. And imagine that took place over the span of a whole night. Patients that haven't been changed, patients that haven't been fed. When the emergency response team showed up the next day, there was no one there. And imagine that's your loved one, soiled, hungry, confused, right? Through C.H.A.N.T training, we can provide that education to others. Because the workers at the skilled nursing facility, chances are they didn't get it there, but they get it in the community from somebody who's not wearing a mask, right? That's who they get it from, and they bring it to the skilled nursing facility where the one person in your family that cannot afford to get sick, that's where that person lives. So all of us play a role in decreasing the spread of infectious diseases. The new government regulations, right? Every single COVID-19 test gets reported to the Department of Public Health. Appendix A through K on the safer reopening guidelines departed by every county Department of Public Health says your employer must report 3 positive cases within 14 days. Are they doing it? Does your supervisor know that they are to report 3 positive cases in 14 days? If they don't, they can be shut down. And I don't know about you, but me personally, I am not in a position to lose a week or 2 weeks of pay due to a shutdown. So a positive 19 case gets reported. The healthcare organization that collects the sample, right, the lab, must report it to the Department of Public Health. That person, that positive case is now referred to as a person under investigation. So now the county has a caseworker assigned to this employee, and they're asking them, where have you been the last 14 days? And the employee says, hey, I don't go anywhere. The only place I go is to work and back. So now that caseworker shows up at your employer. And when they show up at your employer, they say, hey, I'm seeing a lot of lapses here. What is your protocol for COVID-19 positives? What is your temperature screening process? What is your contact tracing protocol? If you don't have anything in place, you are admitting to the Department of Public Health you do not know how to handle a possible outbreak, which makes you a risk to the community, which requires an isolated shutdown. So when you see companies, right, you've seen Mission Foods, you've seen Golden State Foods, you've seen a number of these companies shut down. It's because, yeah, they put up a sign that says no mask, no service, or they put some decals on the floor, but they didn't give anybody any education, which still makes that organization a risk to the community. If you're closed, they keep you under surveillance. If you're closed, there is no incentive for them to be speedy with reopening you. The only way that you ensure that you are not involved in an isolated shutdown is if you have proper education and you have proper policies and procedures to keep your staff safe, right? Governor Newsom says the assumption is that all employees that contract COVID-19, they contracted it from their workplace. The hard cost of a workers' comp injury, originally a soft tissue injury, was the most expensive to employers. But now, a COVID-19 infectious disease related claim, you may not have one employee, you may have 10. You'll have everyone that was within a 6 feet space of exposure. And that circle, they may be exposed to people that are now 12 feet away. So you can see very quickly, if you don't have a protocol in place for identifying and isolating COVID-19 employees, you open yourself up for risk. Does anyone know what the average daily cost of an ICU stay is? The average daily cost is $100,000 per day. At what point does an employer become uninsurable? The same way that a motorist who's had multiple traffic violations and accidents now becomes uninsurable. C.H.A.N.T training is a proactive approach to provide education that ensures business continuity. Right? These are the guidelines for all employers. The federal government says all employers are to do social distancing and provide protective equipment. If you are not ensuring that your staff wear a mask or understand why it's important, you're in violation of the federal guidelines. Temperature checks. How many places are not doing it? Federal government says all employers are to do a temperature check. Your temperature check is your fortress. That is how you guarantee that anyone on this side of this fortress is safe. They're safe for their coworkers. If you're not even doing the screening, how do you know? Employees, teachers, students, members of the community, we have to demand more from our organizations. Safety cannot be a hindrance. It has to be the primary expectation for businesses that are going to remain open during a pandemic. We have another personal story. We have a very experienced nurse who's worked in Canada as well as the United States. Alicia's going to come up and share how COVID-19 has affected her work and her personal life. She has experience in ICU, CCU, telemetry, and also trauma.
Good morning, everyone. Thank you for this opportunity for me to share my story with each of you. My name is Alicia Ben Livingston, and I am a registered nurse with nearly 10 years of critical care experience in both Canada and the United States. Today, I will be sharing a very personal story, which was the eye-opener for me on how real COVID-19 is and how it changed my life. My story begins several months ago on Wednesday, March 11th, when I was scheduled to fly to Canada to attend my bridal shower. As I was waiting to board my flight at LAX airport, everyone was focused on the news as Trump just announced the closure of the US and European borders. Upon his announcement, everyone began to literally freak out, including myself, especially since we were all about to travel outside of the United States. I felt the energy shift in the entire room, and from that point on, I knew everything would change. Upon my arrival to Canada, I began to worry because with the US border closures with Europe, did that mean that the Canadian and US border was next? And if so, would that mean that I would not be allowed to enter back into the States and therefore be separated from my fiance for an unknown period of time? At that point, I felt like I was unable to really enjoy the reason for my travel, which was to celebrate me as a bride. All I can focus my energy on was the fear and anxiety of what COVID-19 was evolving into. I was also considering canceling my bridal shower due to COVID-19. My fiance and I were even considering canceling our wedding, which was scheduled for April, which we ended up doing because we were fearful for our guests and our loved ones. And to top it off, my father was stranded in the Philippines due to the closure of their borders. Just the thought of my father not walking me down the aisle is so heartbreaking and devastating, and it was the deciding factor. I was literally having anxiety attacks about this disease and how it was affecting me personally. But my family and bridesmaids insisted on celebrating, so we continued with my bridal shower. However, many people ended up canceling last minute. Although I really felt the love from my family and friends, I could also sense their panic and fear. It was really an odd feeling having to maintain that social distance and not even being able to hug my aunts due to the fear of transmission of COVID-19. Isn't it such a scary feeling knowing that you can possibly have this disease and not have any symptoms whatsoever? You can easily spread this deadly disease when you are in the pre-symptomatic phase because you won't experience those cardinal symptoms until days after. So leading up to my scheduled flight back to LA on Monday, March 16th, my anxiety continued to build as they were now discussing the closure of the US and Canadian border. I tried to contact my airline and I was on hold for hours, and in the end I wasn't even able to speak to an agent to try to book an earlier flight. So my game plan was to go to the airport 15 hours prior to my flight time just to see if I can get some assistance in person. Luckily, I was able to catch an earlier flight and head back to LA to be reunited with my fiance. However, when I landed in LA and turned my phone on, I realized that I had so many missed calls and text messages. After sifting through them all, I literally just broke down into tears, sitting in the plane reading the words, "Auntie Juvie died." And my initial thought was if it was due to COVID-19. I immediately got on the phone and connected with my sister, who provided me with the details of my aunt's passing. She informed me that my mom, along with other family members, were at their home trying to help with the situation and wait for the coroner to arrive to investigate her death. At that point, my thoughts were racing, thinking, what if I kept my scheduled flight and was present when all of this happened? What if my aunt decided to not cancel her attendance to my bridal shower? I was so fearful for my mom's life at that point because now she could possibly have been exposed to COVID-19 and contract this deadly disease. I honestly felt helpless at that moment because now I'm 1,000 miles away, the border is shut down, and I can't do anything at all. In the following days, I learned that my uncle, who went to my aunt's house to pay his respects at the time of her death, tested positive for COVID-19 and was in the intensive care unit. I was so furious when the information was brought to my attention, because how can someone who is experiencing symptoms, especially those that are suggestive of COVID-19, the coughing, the runny nose, the muscle aches, and a fever, be so selfish and careless to be around people, knowing that you are more than likely infectious? At that time, there was no definitive test available, and there was limiting and conflicting information, which I, as a registered nurse, also questioned. And even up until today, there's no vaccine and no medications that are currently approved for treatment. Now, when I look back and reminisce about that eye-opening weekend, I realize that although I am a registered nurse, and I'm trained to always keep myself and patients safe, outside of my work environment, I too am vulnerable and highly susceptible to this deadly disease like all of you today. Working in healthcare for so many years, I've subconsciously acquired the habit of frequently instilling C.H.A.N.T into my everyday life, especially during my recent travels. I realized I was incorporating C, cover your face, by always having my surgical mask on at all times. And for me, personally, my mask was a constant reminder to not touch my face, which research shows that an individual will touch some part of their face at least 3 to 4 times an hour. So if you're constantly touching your face, how often are you washing your hands? Which leads to H, hand hygiene, where I always kept hand sanitizer with me at all times, especially when I was unable to wash my hands thoroughly for at least 20 seconds. Every single time I touched a surface or an object, like when I took the passport back from the agent, it was a subconscious action for me to use my hand sanitizer. And then there's A, always disinfect. I was always disinfecting the boarding gate and airplane seats that I would sit on, and always wiped down my personal belongings and the table that I would put my stuff on during the flight. And now N, not too close, social distancing. I always made sure I maintained that 6-foot distance with anyone I came in contact with at the airport. Even if someone chose to sit in the seat directly beside me, I would move. And also when boarding the plane, I asked the flight attendant if I could be situated where not many people were around me, which they accommodated, and I'm grateful for. And finally, T, temperature. I was checking my temperature every day that weekend, immediately when I got home from LAX airport as well. I was also checking my fiance's temperature every day due to the fear of transmitting COVID-19 to him if I was exposed to a sick traveler and acquired it at any point during my travels. So this is my personal story on how COVID-19 changed my life and perspective moving forward. I'm sure every single one of you today, whether it is big or small, have been affected by this disease in some way. But I hope today you will realize and understand how important and beneficial this C.H.A.N.T training is, because you are in fact in control of the present time and how you choose to live your life moving forward. If you instill C.H.A.N.T, not only in your work setting, but in your everyday life, you're not only protecting yourself, but you're protecting your loved ones as well. Thank you.
Well, that was a very powerful story, right? Touches on something that's very close to all of us, right? Weddings. Can we get back to seeing our family members at weddings? We can only do it if we decrease the spread of this virus. Pride. Alicia spoke about the pride of her uncle, right? We know when we're sick, but how often are we motivated by maintaining our perfect attendance at work, where we go to work when we're sick? In a pandemic, that is very dangerous to do. We also talk about being afraid to just, as a man, right, we have the whole machismo thing. We don't want to take medication. We don't want to be waited on. But it's okay. During a pandemic, it's very important that we know, we take our temperature, we stay home when we're ill, we isolate from family. That's the education that most Americans don't have. When you're married to a nurse, or you have a parent that's a nurse, or a parent that's a physician, your upbringing is very different. Not only do you wrap Christmas presents with surgical tape, you also understand the importance of washing your hands. You understand the importance of identifying when you have symptoms. That's the education that non-healthcare professionals can get through C.H.A.N.T training. Is your business ready, right? Are you in line with the Reopening America guidelines? Have you established new business norms? The NBA put all of their players and everyone else that's affiliated with the organization in a bubble. What has your organization done? Did they just send an email? Did they put up a sign? There's a better education solution available for you that will keep you safe. It's a proven method, and we want to share it with more and more people that are open to learning. What are your responsibilities in this new norm, right? Do you even know how to have a conversation with an employee that may be perceived as intrusive, right? Do you have that rapport with your staff where they feel comfortable sharing when they're sick? That takes certain training. Do your customers trust you with their safety, right? Will they come back after there's an outbreak or a shutdown? Do you have the proper insurance? Not workers' comp insurance, but do you have nurses on staff? We're here in the Hyatt. The Hyatt has a rotating RN to help answer questions. More organizations need this kind of support. Do you have a plan in place for testing? If you have an outbreak, do you have a plan in place to get your staff tested at a reasonable cost with a reasonable turnaround? We can help you with all of that. Can your business survive an extended closure? If the cases continue to rise and there's another shutdown, what does that mean for your business? As we transition into flu season, who is going to be the support that your business needs for identifying if someone has a common cold, they have the flu, or they have COVID-19? That's the layer of support we can provide to your organization. What is C.H.A.N.T certification? It's an infectious disease education and prevention training program that certifies at least 3 things. Your organization is safe for your customers and community. Your organization is prioritizing the health and safety of your staff. Your organization has taken actions to limit liability. Many business owners have never interacted with anyone other than their tax preparer. But life in a pandemic is different. You need to be aligned with the Department of Public Health. You need to be in line with the new guidelines for Cal OSHA. We know the language, we have the information, we have the experts, and we're willing to partner with you. C.H.A.N.T training is available 14 days from contract signing. You can get C.H.A.N.T certified in every state in America. Why should you get C.H.A.N.T certified? If you value your customers, if you value your staff, and if you value your business, you're going to want this certification. Whatever your core business is, you've been successful at it. If it's teaching others, you've been successful at it. There's no need for you to become an expert on this. The nurses, the physicians, they're the experts, and we're available to partner with you. How do you get certified? You have to complete our 7-step process. Complete an 80-point on-site assessment, which will match the audit of the Department of Public Health. You're going to implement a recommended action plan that'll be provided from a member of the consulting team. Your entire staff will then complete online training, and they will receive a certificate of completion. You'll complete an on-site post-assessment where our nurses will then go over all of the information that was covered online. You'll complete a business management review. You'll obtain your certification, and then you will renew your certification. An ongoing support model is how we ensure the information has been retained. These are some of our past successes. For a large organization, we decreased positive COVID-19 cases by 400% in 2 weeks. We submitted a successful reopening plan to the Los Angeles County Department of Public Health. We have built a liaison relationship between this organization and the county so that they do not live in fear of another shutdown. We've developed COVID-19 testing and return to work protocols, reducing staff absenteeism from 22 days on average to 14.2 days on average. Many businesses are struggling with getting their staff back to work. Through our liaison program with our testing partners, with our telemedicine partners, we get your staff back to work safely in the 14-day quarantine period. For a medium-sized organization, we refortified their entrance screening script, which allowed them to successfully identify COVID-19 positive cases 98% of the time. That's going to ensure that your staff are not sneaking into work while they're sick. We've established partnerships with vendors to get you EPA-approved cleaning solutions so your staff don't question what you're using to disinfect. Developed contact tracing protocols so that your business can successfully identify, expose COVID-19 people 99% of the time. So just because you find the one person that reports it, do you have a contact tracing protocol to identify their sphere of exposure? We can do that for you. You can establish ongoing RN support where you can have an RN round, talk with your staff, answer questions. For a small business, we boast that our online training module has a 97% retention rate. If you think your staff huddles have been somewhat ineffective, know that completing the online training ensures that your staff retain the information. Continue rounding on staff in order to hardwire the best practices. Once again, decrease positive cases by 400%. If you're struggling with COVID-19 now, October is going to be worse. Science has proven October is going to be worse. Be proactive, partner with an organization like ours, keep your staff, keep your customers, and keep your business safe, right? We reiterate, chant, cover your face, hand hygiene, always disinfect, not too close, and temperature screening. The key actions are easy enough to remember. There is value in bringing in our most trusted advisors in our community, physicians and nurses, and hearing it from a neutral third party. We want to partner with organizations, with community groups, with the ultimate goal of us having pure intentions, which will create a safe environment for your workers while they're at work and while they're out in the community. We want you to invest in C.H.A.N.T training to ensure business continuity. The CDC has shown you what to do. Let C.H.A.N.T training show you how to do it. Get C.H.A.N.T certified today. It's difficult for us to invite our online audience to the Q&A, but I would love to hear from you. I'm assuming one of you is a personal contact of ours. Our Instagram is @CHANT_training. If you have any questions about getting certified or just questions about infectious diseases, we want to hear from you. We thank you guys for joining, and we'll see you again soon. Thank you, and stay safe.